Well, Hong Kong is just one of several places across the region to renew restrictions in the face of fresh COVID-19 outbreaks. And for more on the pandemic, Associate Professor Sanjaya Senanayake joins us live. He's an infectious diseases specialist with Australian National University Medical School in Canberra. Thank you very much, Professor, for joining us. So first up, let's look at Australia, Vietnam, Philippines, Hong Kong, plus a resurgence of coronavirus cases in the US and the UK. Now, are things looking like it's spiraling out of control, and also why now?
Sure. Glenda, I think things do look like they're spiraling out of control, but I think many of these countries, Australia included, where I am, can get these outbreaks back under control. But what we're unfortunately seeing is the nature of this pandemic, where in many countries, they've managed to have, after their first wave of infection, they've managed to have control where they've had perhaps low numbers of infection that have not inhibited the lifting of certain restrictions and a slow return to normal life. But then there has been some amplification of an outbreak, and that has led to a second surge. Now, in Melbourne, this seems to have occurred through hotel quarantine. In other countries, it has occurred in other situations, but it is the nature of this outbreak and this virus. And until we get a vaccine or a medication that you and I can take every day, a tablet that prevents us from getting it, this may be the way of the future.
Well, the WHO says there might be no silver bullet to deal with the virus. So what's your thoughts on that? And what will it mean for everyone on the planet if this COVID-19 is just, doesn't go away?
Sure. So I think he is right. It is possible that none of the vaccines may be effective. That is a possibility we have to prepare for. Having said that, given that the quickest vaccine to be developed took 4 years, it is absolutely extraordinary and unprecedented what we're seeing now with COVID-19 in terms of vaccine development. It's amazing. The other thing I would say, I'm a bit more optimistic. There are about 165 vaccine candidates that are in different stages of testing. We know that 90% of vaccines fail, 10% of them tend to work. So if we get 15 vaccines out of this that work, we should hopefully be okay. But if it turns out that none of them work or the immunity's very short-lived, etc., then we may be living in a world where we have to try and either eliminate COVID within our region or country or control it, so have small numbers of acceptable levels. And in terms of global trade and travel, it may be we just interchange tourists, etc., from similar areas to us. So low transmission areas to low transmission areas, high transmission to high transmission. But hopefully it won't be like that.
Well, let's look at how it all started, because the WHO says that the groundwork is complete for an investigation into the source of the virus outbreak. What does that mean? How long more before we can actually get some useful information?
Yes. So, Glenda, I think what has happened is 2 World Health Organization officials have been in China talking to various scientists and epidemiologists there and reviewing all the data, trying to understand where this may have originated from. And I believe that process is over, but it still may take another 3 weeks or so for a full international team to come over there and start the search. But look, it is important to try and work out where this came from, particularly now as most of the emerging infections that we've seen over the last 40 or so years have been from animals, what we call zoonoses, and they've all got potential pandemic potential. So it is important to understand where they came from and try and prevent spillover with this pandemic, further spillover with this pandemic, and future pandemics with other viruses.
Well, thank you so much for speaking to us and helping us understand. We've been speaking with Associate Professor Sanjaya Senanayake from ANU Medical School.